NICD, the National Institute for Communicable Diseases here, has said that the suspension of flights from India would not necessarily prevent a new Covid-19 variant from reaching our shores. Dr. Michelle Groom is the head of the Public Health Surveillance and Response at the NICD. She joins us now. Dr. Groom, good afternoon to you, and thank you very much indeed for your time. We have a variant that seems to be dominant in India. It's got a long, complicated name with lots of numbers in it. Is that variant in any way more dangerous or more easily transmissible than the two variants that have been dominant here?
Good evening, or good afternoon, Stephen, and thanks for your question. Yes, I think there are actually several variants which are circulating in India at the moment. The one that was first identified in South Africa being one of them, and also the one that was identified in the UK. And you're right, there are all these long numbers, but the one we're talking about from India is the B1617. There's not a lot of testing being done in India, so it's quite difficult to know exactly if it is the dominant strain, but definitely in some of the bigger centers, it seems to be taking over as the dominant strain, and that one thing that might point to it potentially being more transmissible. When comparing, we haven't done any comparisons to our variant at the moment, so it's difficult to say what would happen if and probably when we detect it in South Africa, because our variant itself has some of the same mutations as the one that has been detected in India.
So we've seen, and I think there's some research, I think it's still a preprint paper, but bits of it have emerged into the public domain this morning, suggesting that during the second wave, when the second variant in South Africa was dominant, I'm talking about the December-January wave, if I can call it that, the death rate was slightly higher, I think by 20%, partly because of the variant and partly because of the added pressure on public health care services. And the reason I bring this up is, so you're saying then it's quite difficult to know if the variant in India is actually more dangerous than the variant first seen here, which we understand is probably more dangerous than the first variant we had.
Yeah, so these mutations are developing all over the world, and the ones that have been identified kind of in the UK, our one, and some of the others, like the one in Brazil, they do have some similar mutations, you know, so they have these mutations in what we call in the spike protein, which can enable it to be more transmissible or potentially to get the better of our immune systems. So I think at the moment we really aren't sure. I think other countries are also, you know, this variant from India has now spread into many other countries. I think there's around 20 countries, including the UK and the US. And so we will hopefully be able to tell soon whether this variant is more transmissible. And it's difficult to compare one variant against the next. So yeah, we're keeping tabs on what's happening in South Africa, and the groups that are doing the sequencing of the virus, you know, we will be able to pick up whether we're detecting that variant in South Africa.
Can we be sure that the variant that we think may be dominant in India is not here already? I mean, is there any way of knowing if it's here or not?
Well, we don't know. I mean, we haven't detected it, which is through our testing, but obviously we can't test every single sample. We've been prioritizing, you know, those that are coming back, travelers that are coming in from India, and definitely the case, I think, that was highlighted yesterday in KZN, you know, that sample has definitely been sequenced, and we should have an answer by the end of the week. So we don't know. It may well be here, but we have not, you know, detected it through our testing.
So just to be clear, if someone is diagnosed as positive for the COVID-19, they wouldn't necessarily know or be told, or their sample wouldn't necessarily be tested for which variant it is, unless you were looking for something specific. Have I got that right?
Yeah, so we're doing we've been seeing a few clusters over the last couple of weeks, and so we've been prioritizing, you know, testing of these clusters so that we have a good representation. And as I say, if we can prioritize travelers coming in, we've got a better chance of then detecting, you know, that variant that may be coming in from without our border.
So how would we know? And I suppose what that really leads to, unless we get a particular cluster or a particular spike that is traced back then to someone who's been to India. And I mean, I know, for example, I think there was a case of this variant found in it was either Uganda or Ghana over a month
Uganda.
ago.
Yeah,
Uganda.
it was
so, I mean,
Uganda.
It's been in our continent for over a month. So there's no real way to know.
No, I mean, we don't. I mean, we know from the testing that we've done that really our variant has been very dominant and kind of, you know, overtook from all the other, you know, virus, you know, types or mutations that were previously here. And it was detected, first in October last year. So it has been around. There's various reasons why, India has been, it's not just the variants. I think there were some other, they had several, large religious and social gatherings and political gatherings that, so I think it's the variant, and generally in combination with other things like relaxation of the non-pharmaceutical interventions. And so, yeah, we don't know. And I think the thing is, these variants will come along. COVID isn't going away anytime soon, and it doesn't necessarily change the way that we deal with the virus. We will continue testing, we will continue rolling out the vaccine, and, practicing social distancing, hand hygiene, and wearing of masks. So it doesn't really change that.
So in other words, I mean, and I understand, emotively, I understand the calls to say stop people from India coming here. I think Australia is taking some drastic action on that, although their picture is slightly different. From where you sit then, closing our borders to anyone who's been to India wouldn't actually help us very much.
Yeah, look, I mean, I think we saw at the beginning of the pandemic, I think, these things, it may already be here. And I think closing the border doesn't necessarily, I think we just need to be, we're screening at the borders. This isn't going to be the last variant. The viruses will keep, this virus will keep mutating. And I think we just need to keep the measures in place. And yeah, I think it will be interesting to see how, whether it would replace our variant, as our variant was also more transmissible than the original one.
And then all of this leads to, I suppose, in a way, the other question that kind of really matters, and I don't know if the science is definitive on this, and I think you know where I'm going, which is around immunity. In other words, if you've had, let's call it the first variant or the second variant which came through here, does that mean that you are protected against the variant from India? And I suppose the science isn't definitive yet.
Yeah, we haven't. So we will be, we are doing work on that. And what was shown with the variant, the B1351 that we detected here, that people who had been exposed to that variant and developed immune response were protected against the original variant, although it didn't work the other way around. And so we would hope that if some of the mutations are similar, that we may have some, underlying, immunity to some of the new variants. But we will. The science is ongoing, and we definitely have several groups in South Africa who will be looking at that. And we should have some more information in the coming weeks.
Dr. Michelle Groom, I really appreciate the time. Thank you. Head of the Public Health Surveillance and Response Team at the National Institute for Communicable Diseases.